Evening, we're live. It's happening 7 o'clock Tuesday night, and immensely grateful to have some questions from the little sticker that we put on Instagram. So thank you for that, muchly. So I'm going to start with those because I usually, to be honest, P and EX, I usually forget those. So I've made, hi Corinne, good to see you. Jackie's in the house. So I usually forget these, so I'm going to answer them now. BAGA. So a BAGA, can you, BA under GA, can you still go home the same day? Hey, Ashley, good to see you. How you doing? They tell me that I shouldn't say hello to people during the questions. But anyway. So can you still go home same day with a BA under GA? Yep, you can. So we used to, BA under GA is the I guess the sort of standard way of doing it. More and more local and sedation, the twilight is coming in. Personally, I've gone a sort of bit up and down really. So there was a time when we thought local and sedation was great, and now we're sort of back on GA. We can still do it under local and sedation, but they're quite similar. The level of sedation with local and sedation is you're quite sedated, so you are quite sort of drowsy. But you can for sure go home under a GA just as well you can go home under a local and sedation. Having said that, you do recover better from a local and sedation, but you still recover fine from a GA because it's only an hour or so, hour and a half operation. So yes, you can definitely do a BA under GA as a day case. Absolutely no problem at all. And we do it all the time. Hi, Corinne. Have you found your shoe? No, actually, Corinne, my shoe has been missing for a long time, like for weeks. So I feel it's in the garden. Well, I found the other shoe in the garden, so I assume. So I found one of them in the garden. So I think I don't know what you know. I don't know what was posted. Something was posted about my shoe going missing. Was it that I only got one shoe? So I found one of them in the garden. Can't find the other one. I'm assuming it's in the garden somewhere. So the dog has taken it. So and they're special shoes that clip into the pedals of my bike. So I've already got one, but no, I haven't found the other one. Probably come up one day, and it'll probably be in a right state, won't it? Because it's like literally been weeks. It's been missing. Can you do breast lift and reduction on sedation? Yes. So a small reduction, I would say. Well, I guess the question is, can I do it or can people do it? People are doing quite big stuff under local and sedation. I mean, some people do nothing. This is the problem with plastic surgery. Some people do nothing under local and sedation. Can I just say, should I have made sure that the microphones are working? Should I use, I'm going to use a different one because that's dodgy, that microphone. That one, I think that was better. Hello, hello, hello. Yeah. So some people don't do anything under local and sedation. Some people do everything under local and sedation, and there's people in between. And I'm one of those. I'm an in-betweener in many ways. And I would say a breast lift, yes, for sure, you can do under local and sedation. A breast reduction for what I call a normal breast reduction, yes. But for a bigger breast reduction, I would probably feel more comfortable with GA. Just because it gets a bit more difficult. Although, as I say, I know people that are doing bigger breast reductions under local and sedation, but I would find it a little bit difficult to get the local, without putting too much local in, and although you use diluted local. But yeah, I would say a sort of smaller / standard breast reduction and a breast lift would be fine under local and sedation. And the places where I work now, they can do GA. So we often say to people, look, why don't we just see how we go under local and sedation, and if it's uncomfortable, we can convert to GA. So that's always an option. Start off with local and sedation, and if it's fine, then it's fine. But if it's not, then we can convert. So the other question on the tab was, I can't read my writing. Oh yeah, prior to surgery, you have to stop medication, e.g. birth control. That's right. So depends a little bit on the operation. The smaller operations, definitely not. The bigger operations, it would be very much surgeon dependent, because medication can have an effect, and birth control is one of those medications that can have an effect. in that it can increase your risk of DVT and PE, which are clots in your legs that can fly off into your lungs. So if we're talking BA, breast augmentation, then I would say it's not a problem carrying on that. If it was a bigger operation, personally, I don't stop birth control or HRT. It's the same. It's not the same thing, but it's the same. It causes the same problems. Both of them cause DVTs and PEs. So I don't stop either of those before surgery, but some surgeons would, especially for bigger surgeries like tummy tucks, which have got an increased risk of DVT and PE, because that's a significant complication. If you are going to stop those medications, then you have to put alternative measures in place, particularly, birth control, because you don't want unwanted pregnancies, because that has its own morbidity, and there's also morbidity associated with stopping HRT. So there's downsides with stopping it, but the upside of stopping it is that it's less risk of DVT, and it is surgeon dependent. Some surgeons, what I know, do stop it, I think 6 weeks before. So it's not unusual for surgeons to stop that. But my view is that I don't stop it, I carry it on. But we put measures in place to reduce the risk of DVT, Flowtron boots, TED stockings, Clexane, like heparin injection, blood thinners, and the most important one, early mobilization, get you up and walking ASAP. That's really important to reduce your risk of DVT. To be fair, I think that's as important as any of the other measures, just getting you up and about. Yeah, so those are the 2 sticker questions. Awesome for that. Very grateful to you for those. Can I still have breast augmentation if my doctor wants to give me injections for suspected carpal tunnel? Yeah, for sure. So injections for suspected carpal tunnel is usually some steroid or something into your wrist, and that's absolutely fine prior to surgery. The only thing about that sort of thing is that you might be uncomfortable. I mean, I don't know how much before the surgery you're going to have the injection. You might be a bit uncomfortable. So you probably wouldn't want it the day before, but there's no sort of interaction between having an injection for carpal tunnel and having a breast augmentation. Absolutely fine. Do we offer umbilicoplasty at our clinic? Umbilicoplasty is quite a general term. Plasty just means changing the shape of, plastikos from the Greek, changing the shape of, plastic surgeon. So plasty is changing the shape of. Umbilico is belly button. So do we offer belly button shape changing surgery at our clinic? And it can range from anything from umbilical reconstruction, so people who are born without a belly button or have had their belly button removed due to some abdominal surgery, so reconstructing it from scratch, up to reshaping it if it's too wide or too narrow, or if there's an outie, if there's a hernia there. So there's all sorts of things that it could encompass. So what I said to this person is if they could send us a photo or give us an idea of what the problem is. Most things we can address, and most times we're doing umbilicoplasties would be following a tummy tuck if we're reshaping the tummy button after a tummy tuck, and that's something we're quite familiar with and would do routinely if there's a problem with the shape of the tummy button. Reconstructing it from scratch, yes, we could do. A little bit difficult. It's a little bit like a nipple reconstruction. In a nipple reconstruction, you want to stick out. An umbilical reconstruction, you want to go in. And either way, the scars want to take the path of least resistance, which is a flat line. So nipples tend to shrink, and umbilical belly button holes tend to flatten off. So both of them tend to flatten off. So there is a risk with that. If there was a significant hernia there, I'd probably say general surgeon, because they sort of repair hernias. We can repair very small hernias, and it's not unusual to repair a hernia during a tummy tuck. Sometimes you find them incidentally, sometimes you can feel them pre-op, but a small hernia we might fix. But if you've got a big umbilical hernia, then I'd probably suggest a different sort of surgeon. So most things we can address in terms of the shape of your belly button and reshaping said thing. Do we offer treatment for dark circles around the eyes? No, we don't. I don't do facial stuff. I just do breast and body. So I don't do any sort of facial aesthetic surgery. So that would probably be something non-surgical. So probably be, a lot of plastic surgeons do non-surgical work. A lot of aesthetic practitioners do non-surgical work. I normally refer people to Claire Oliver at Air Aesthetics, which is down in Henley and Arden. I know her, and I often send patients who want non-surgical treatments there just because I know her. But yeah, we don't do that sort of thing. There's also actually a place around the corner from where I am called the Sky Clinic, which is a cosmetic sort of non-surgical clinic around the corner. So there are people who kind of specialize in non-surgical. I put myself into a specializing in surgical type of guy. So yeah, sorry, we don't offer that sort of thing. Why is BMI such an important factor when wanting to have surgery? Well, there's two reasons, and one reason is that they have done studies where they've said that the higher the BMI, the higher the risk of complications. When they've done those studies, they looked at a BMI of 30, and they said if your BMI is above 30, you've got an increased risk of complications, wound healing problems, respiratory problems, chest infection, pneumonia, DVT, PE. These risks are higher at higher BMIs. So if your BMI is lower, you are going to reduce your risk of complications. Now, nothing magical happens at 30, but just generally speaking, the lower your BMI, the less your risk of complications. So obviously that's quite an important factor. But the other factor about BMI and surgery is the fact that if your weight changes, then your body changes. And if you're having body contouring surgery, ideally, you don't want to do it on something that's changing. You want to do it on something that's static so that your surgery will hopefully you'll get it right. You'll make your body look how you want it to look, whether it be the size or shape of your breast, the shape of your tummy, whatever it is. But if then you were to lose a significant amount of weight, your breast might droop. There might be some laxity in the skin of your tummy. Similarly, if you want to put on weight, things might get bigger. And probably the worst thing you can do is put on and lose weight, because that's what causes a lot of people to need body contouring surgery in the first place. That stretches the skin, makes your breast droops and your tummy skin droop. So if you were to lose, or at least put on and lose a significant amount of weight after surgery, you could almost undo the work that you've had done. So, obviously you don't want to pay all this money and have a tummy tuck or whatever, and then put on and lose a significant amount of weight and stretch that skin again. So that's really important when you're having body contouring surgery, because you want to have as long lasting a result as physically possible. So whilst they usually talk about BMI of 30 in terms of the complications, I usually say to people, look, if you're not happy with your weight, you need to lose weight first. And that could be if your BMI is below 30. So your BMI might be 28, 29, but you want to lose weight. I'd say, look, lose weight first. Don't have surgery now, even though on paper you've got the BMI below 30. You've got to get your weight stable. So if you're losing weight, lose weight first and then have the surgery, because you really want to be doing it on a stable platform. If having surgery at your clinic, do I need to wait 6 weeks following surgery before I can go abroad? I really want a breast reduction, but I have lots of holidays planned for this year. Again, we're not very strict. The royal we, telling the children about the royal we. So I'm not very strict with this sort of thing. I kind of will advise you, but I'm not going to check your diary. I'm not going to check your plane tickets. I will advise you. And my advice is to wait. 6 weeks is kind of normal. A breast reduction is quite a big operation. So 6 weeks is kind of normal before having going abroad. Now, we all know people go abroad, have breast reductions, and then come back the next day. So you can get on a plane the day after a breast reduction, and people are doing it all the time. But I wouldn't particularly recommend it for several reasons. First of all, going on a plane increases your risk of DVT, which is a risk of any surgery. So you don't want to multiply up your risks of DVT, clots in your legs. But secondly, if you go on a plane and go to wherever, Marbella, there's often issues after a breast reduction. In the weeks following a breast reduction, you might get a little bit of wound breakdown, particularly where the scars meet, two scars cross. You might get a little scabby bit, you might get a little sore area. The shape might not be right, one might be more swollen than the other. There's all sorts of issues. And we'll say, look, come on here, let's have a look. And oh, look, that's a little bit of infection or something, you might need some antibiotics or something. If you're in Marbella, everything's difficult. It's just all difficult. If you're to get, it's not impossible. You probably could get antibiotics somehow, but it's not going to be easy. And so I would say, look, make it easy on yourself. Wait until everything's, largely settled. The shape probably won't still be right at 6 weeks. Your scar will still be a bit red, but at least you're out of the woods in terms of wound healing infections and those sorts of issues. So 6 weeks is kind of where I would say is where you want to be after a big operation like this. And if you've got a lot of holidays planned this year, well, maybe have it next year, or maybe have it at a time when you haven't got lots of holidays planned, because really this is a life event and you want to maximize your chances of wound healing properly. You don't really want to be on holiday with a dressing on your breast, with a wound that's like having to change the dressing and all that sort of stuff. It's just stress you don't need in your life. Do it at a time when you've got a bit of space. Having said all of that, if you say, look, it's it's very convenient for me to have it now, and I want to go to Marbella after a few weeks, and I won't say, well, I won't do the surgery. I'll say, well, look, you will probably be fine. Most people are absolutely fine, but I've got to put the word probably in there. There is a risk you could go to Marbella with a wound. There is a risk that you could have to cancel your holiday if you're feeling really ill and you've got a big problem. They're not common having big problems, but I can't guarantee you won't get one. So, if you're okay with all of that and you say, look, you're saying that it's probably going to be all right, and I'm like, yes, I am saying that, then you could go ahead with it. But it's kind of like a personal decision. And I would say, look, it's a major life event. You don't want to be jet setting all over the place and putting stress on yourself if you've got a wound or if you've got a bit of swelling or a bit of tenderness and you're going on holiday all over the place. It's kind of going to ruin your holiday a little bit, and you kind of might not want that. So I would say 6 weeks is kind of normal, but not written in stone. It is advisory, not compulsory. Right, that's 5 questions. If anyone's got any questions, they can ask me. Might have a few minutes just before I've got to go and sit on the sofa. Anyone got any questions? Do you know what? I went to work today and I realised I hadn't shaved. Is that bad? Does it kind of just look like a full beard? I thought, oh my God, I haven't shaved. Oh, what a slapdash man. What a slapdash man, honestly. Look at the state of it. I'm looking at the state of myself. I look a lot better on Instagram than I do on Facebook for some reason. It's the lighting or something. Instagram's on the phone. Yeah, do I need it? Am I looking a bit pale? I look pale on Facebook. I think I look better on Instagram. I look a bit more yellow on Instagram, but I look quite white on Facebook. I don't know. Must be the camera. Yeah. It is a lovely evening out there. Yeah. All right then. Thanks, Corinne. You likewise get yourself out there. I will be back next week, same time. Will I? It's half term, isn't it? I might be going on the camper van. I haven't actually booked it yet, but I might be doing a camper van because, yeah. So I might be out on the camper van next week. If not, it'll be the week after. If I am here next week, then the camper van hasn't happened, or I'm back because I've got a clinic Wednesday, so I might be back Tuesday night. Anyway, oh God, may or may not be back next week. Tuesday near you, I will be here. Yes, half term, I know, but I have got a clinic on Wednesday for some reason. Thanks, Jackie. Thank you. It's kind of you to say. That's what I was looking for, Jackie. That was I was fishing. Got it. Thank you. Excellent. Instagram's on the phone. Right, guys. Take it easy. Yeah, go and enjoy the sunshine. And next week / the week after, I will see you then. Hasta la vista. And the stream. And now. All right, Facebook lovelies. I will see you in a week or so. Stop.